Yeah, so although not as deadly as COVID, flu can definitely be a deadly illness. We had a relatively quiet flu season last year due to masking, social distancing, and vaccination awareness. However, it is not uncommon to hear numbers of 10 to 20,000 deaths a year from the flu. Most of these deaths arise in the elderly, very young, and people who have many medical conditions. Although it seems like every year we do come across one or two tragic cases of young children or teenagers passing away from the flu. COVID-19, on the other hand, is a little bit more deadly of a virus and poses a bigger risk for the elderly people and those who have multiple medical comorbidities. Fortunately, severe disease is uncommon with children. However, with the Delta variant kind of sweeping through the nation, appears children are going to be affected by this as well, although not quite as hard as adults. The flu is very contagious, mainly spreads through respiratory droplets. So basically the droplets that we breathe in and breathe out as we discuss and talk and have conversations. It is estimated that the R naught, which is a measure that we use to detect infectivity, the R naught for influenza is about 1.3 to 1.5. That means that for every one person infected with the flu, that person will infect 1.3 to 1.5 people. To put this in perspective, the COVID-19 R naught varies, but the CDC and multiple schools of public health have suggested that an R naught between 1.8 and 3. So that means for every one person infected with COVID-19, that person will spread it on to 1.8 to 3 others. So once you start scaling those numbers, then you can really see how we got to where we are and how you have a big problem on your hands. So I think we could probably curb a lot of these numbers by, isolating, quarantining, and practicing our good hygienic behavior, along with masking, social distancing, and vaccination, as we are doing around the nation.